Hello judges, my name is Katie Poole and this is my clinical specialty presentation. A common misconception about PAs is since they are physician assistants, they must just follow the doctor around and do as they're told. Wrong. Physician assistants are independent workers who can see patients alone. They are not just a doctor's shadow. The doctor can offer more of a support system, someone to bounce your ideas off of, or someone to just check back with if you're a little unsure on something. Independency is a quality I pride myself on. I'm proud that I can make a decision for myself or for others that's beneficial. A PA can do this. But being a PA also offers reassurance from someone who might have more training than you. So, say the doctor that you work under. When people's lives are on the line, having the support system behind me is the type of industry I want to go into. PAs can also work to solve a wide variety of health concerns. PAs can work in disease prevention, treatment, management, as well as just promoting good health practices. PAs will have regular patient contact. They can order tests and prescriptions. They can perform examinations, as well as ask questions to form a diagnosis. In terms of becoming a PA, though, there's two education pathways. The first and more common method is first going to school to get a bachelor's degree in science, typically biology, but there is some wiggle room. Most four-year colleges actually do have programs called pre-PA programs, which after 4 years, you will come out with that same science bachelor's degree. The next step would then be applying to a different college accredited by the Accreditation Review Commission on Education of Physician Assistants. You would then come out with your master's degree in physician assistant studies 2 years later. The second method is the accelerated program. You apply to only one school, one time. And in between 5 to 6 years, you will come out with that same science bachelor's and same physician assistant studies master's degree. Both methods include in and out of school teachings, clinical rotations, up to 2,000 clinical hours, and labs. The next step would be becoming certified. You must pass the Physician Assistant National Certifying Exam provided by the National Commission on Certification of Physician Assistants. To continue practicing medicine, you must participate in continuing education every 2 years and participate in continuing education for recertification every 10 years. I will be pursuing the accelerated version. I'm quite an active person, and the go manner of such a rigorous program fits my abilities and desires to a T. For some, the longer, less condensed program would be a better fit, but I've been furthering my education into the accelerated program for years. And especially now since I'm dual enrolled in college and I'm taking classes to help further my medical career. After education completion, one would reasonably start to look for a job. PAs can work in a variety of places, making it way easier to become employed. They can work in hospitals, to clinics, to offices, to even more places than this. And PA employment is expected to grow a whopping 37% between 2016 and 2026. Did you know physician assistants only actually emerged in the 1960s, and it was due to a doctor shortage, which is still in effect today. Since then, the role of PAs has become more and more important in the healthcare system. PAs can now work in tandem with physicians to help decrease the overwhelming workload on physicians from too many patients. It also allows for shorter wait time. Since more healthcare providers are available, more treatment can be given. PAs also offer great flexibility in terms of what medical division they can work in. I'm a very versatile person, and I have the capacity and capabilities to change the focus of my work or studies quickly, just as a PA might have to do. Since PAs have training in all medical divisions, they don't need to go back to school for an extensive amount of time like a doctor might. But they can also perform mostly the same roles as a doctor, unlike a nurse who, say, can't prescribe medication. For me, being a PA was always a happy medium between being a doctor and being a nurse. It allowed for full immersion into the medical field with few limitations. It allowed me to perform treatment, give diagnoses, just like a doctor might, but it also allowed for me to lend that helping hand like a nurse might. But opposed to NPs who must be nurses before they are nurse practitioners, PAs jump right into the action right from the very beginning and don't need to be nurses and thus have those restrictions. I'm a very action-based person, hence PA is right for me over NP. As I said, PAs can help reduce workload. For example, if a clinic had, say, 1,000 patients and only 2 doctors, that clinic could be backed up for months, possibly even longer. By implementing PAs, patients could be more evenly distributed between PAs and physicians, allowing for more treatment and all for less training and schooling. Therefore, those 1,000 patients are more evenly distributed and all members of the system are happy. PAs are versatile and imperative to a successful healthcare field. As I have further developed my achievements to become a PA in the future, I've used my knowledge as the patient to determine how I will act as the PA. Being a type 1 diabetic since I was 2, I've played the role of patient many a times. Now, I wish to become the caretaker. I carry the experience with me as both the patient and the caretaker, which gives me an insider scoop on the best way to act with patients. What to do, what not to do. Diabetes has never been a crutch for me. If anything, it has helped shape the path my life will take for the rest of my life. This concludes my speech. Thank you, judges.